Welcome. My name is Heather Forgione, Program Manager for the Lankenau Heart Institute Women's Heart Initiative, part of Mainline Health. I want to thank you for having me to present to you today. For most of the women watching this video, 1 out of 2 of you will be impacted by cardiovascular disease in your lifetime. But to better understand this, we really need to know what is coronary artery disease. Coronary artery disease, CAD, is caused by plaque buildup in the walls of the arteries that supply blood to the heart and other parts of the body. CAD is the most common type of heart disease. So if you can see in here, I don't know if you can see my mouse, a normal artery is nice and smooth, where the narrowing from this plaque buildup is what coronary artery disease is. So here's a question. Is breast cancer the leading cause of death for US women? False. Actually, heart disease is the #1 killer of women. I love this, this little graphic right here by the American Heart Association Go Red for Women campaign. And for cardiovascular deaths in the United States for women alone is 400,000 a year. And if you look at this red dress, that indicates heart disease, but it kills more women than most cancers combined. 68% of Americans do not know heart disease is the foremost killer of women. 80% of coronary artery disease cases in women are preventable, and 44% of women are unaware that heart disease is the leading cause of death. 26% of women will die within a year of a heart attack compared to 19% of men. True or false? There are no significant racial differences in women and heart disease. False. So Hispanic women are likely to develop heart disease within 10 years earlier than their white counterparts. Only 1 in 4 Hispanic women are aware of treatment options. African American women ages 20 and older, 47% have cardiovascular disease, yet only 1 in 5 African American women thinks she is personally at risk. So we need to do a better job with that by doing more education in our community. More than 40% of African Americans have hypertension, and hypertension is more severe in African American women than in their white counterparts. So the hard truth is women take care of everyone in their families, and they leave themselves on the back burner. So one of the things that women do is they delay seeking help longer than men, resulting in higher rates of mortality and morbidity among women. Women are the decision makers of the family. They take care of everyone except for themselves. Studies have shown that women with a heart attack are less likely to be treated with guideline-directed medical therapies, less likely to undergo cardiac catheterization, and less likely to receive timely perfusion. So we really need to look at heart disease as a whole for women as the #1 killer, and we are making headlines. But despite increases in awareness over the past decade, only about half of women recognize that heart disease is the #1 killer. So we need to do more. We need to do more outreach. So let's take a look and do a deeper dive about male pattern versus female pattern heart disease. And I love this slide that was taken from Dr. Noelle Barry-Merz from Cedars-Sinai. She is the co-lead investigator of the WISE study, which is the Women's Ischemia Syndrome Evaluation. So they did this study because they wanted to know more and more about women, why women were dying of heart disease. So what they found was women erode, men explode, which is an interesting factor, but we'll move on from that. These 2 pictures are of coronary arteries. And if you can see at the bottom where it says men explode, that is a typical male pattern heart attack. Crushing chest pain. They go to the emergency room. Their blood pressure is elevated. Their EKG looks like blah. And then from those diagnostic testing, they can go for advanced therapies such as a cardiac catheterization and open that blockage. That's considered a male pattern heart attack. Some women have that, Hollywood chest pain, but a lot of women are having what's called erode. Women erode. So they have subtle symptoms such as chest pain, not crushing, but some chest pain, jaw pain, back, pain down one arm, nausea, shortness of breath. And what happens is the reason why women delay their care is because it's not the typical Hollywood crushing chest pain that would indicate that they need to go to the emergency room. So let's just say a woman goes to the emergency room and they have some pain in their left arm. Well, it's not considered the normal traditional type heart attack. So, the clinicians in the emergency room will look at their blood pressure. Their blood pressure looks fine. Their EKG looks fine. So they really have to dig deeper to see what the source of the pain is. So that is why there's such a delay in treatment and care. And we need to do a better job in educating our providers and clinicians in emergency rooms. So this is a great infographic that we partnered with the American Heart Association to give out to women in our community, to have them put on refrigerators that these are the unique type of signs and symptoms that women may have: neck, jaw, shoulder, upper back, or abdominal discomfort, shortness of breath, pain in one or both arms, nausea or vomiting, sweating, lightheadedness or dizziness, or unusual fatigue. These are the signs and symptoms that we really are trying to get women in our community to really understand that these are the types of symptoms that you could have, and this could be heart attack related. So how would you say that we're doing as a whole? Well, over the years, we have done a lot, but unfortunately, we need to do better. So despite improvements in cardiovascular mortality for women, overall, over the past decade, these rates of cardiovascular disease are still rising. A woman dies every 34 seconds from heart disease, and coronary heart disease remains understudied, underdiagnosed, and undertreated in women. Women also have a higher prevalence in comorbidities such as diabetes, hypertension, depression, renal insufficiency, and heart failure. So what do we need to do to reduce our risk for heart disease? Well, the Women's Heart Initiative, part of Mainline Health, they have 16 female cardiologists that put together this risk assessment tool that you can find on our website at www.mainlinehealth.org/WHI. What we do is this risk assessment tool is specific to women. It has the traditional risk factors that I'll talk to you about in a moment, but it also has the unique traditional risk factors that we're really trying women to really force women to talk to their primary physician about their heart health. And what we're looking at on this is that if you have 4 or more, you really need to have a conversation with your heart or with your doctor about your heart health. But just want to let you know that there was this infographic that came out of the American College of Cardiology about, they did a study, and what they found was that only 39% of primary care physicians make cardiovascular disease a top priority. And only 22% of primary care physicians and 42% of cardiologists feel well prepared to assess a woman's cardiovascular disease risk. So we need to invest in more research and also physician education and training. So some of the traditional factors that we're talking about are the ones that you probably know about: diabetes, smoking, obesity, physical inactivity, hypertension, high cholesterol. but there are the ones that we are not really familiar with, which is pregnancy complications, autoimmune disease, cancer treatments, and depression. So we're going to take a deeper dive into that. But before we do have a beautiful guidebook that is free that you can download a copy at www.mainlinehealth.org/WHI. It was developed by our team of female cardiologists. Also with this is it gives you a call to action on what to do. So it's a great read. I hope you enjoy, download your free copy today. So let's talk about the risk factors that we cannot change. Love to change our age, but if you are 55 and older, it does put you at risk. If you have a family history, which consists of female first-degree relatives, a mother or sister with heart attack or stroke before the age of 65. If you have a male first-degree relative, father, brother with a heart attack or stroke before the age 55, or if you have a family history, diseases of the aorta or valves, this puts you at risk. So there's really nothing that you can do, but it's good for you to talk to your doctor regarding your cardiac family history. One of the ones that we can't change as well is early menopause. So menopause, anything before the age of 45, as many as 10% of women experience natural menopause by the age of 45 years. But with women, premature menopause or early menopause onset, you're at an increased risk for cardiovascular disease, stroke, or death. So it's really important to have this dialogue with your OBGYN, but also your primary physician as well in terms of what you can do to lower your risk of heart disease. So another thing that is unique and new that a lot of women don't know about is pregnancy history. So a lot of cardiologists and primary care physicians don't ask these types of questions. And one of the things that you should know is if you've had any pregnancy complications, such as preeclampsia or gestational diabetes, you have a serious high risk. It's a twofold increased risk of future cardiovascular disease. So it's important to share your history with your primary cardiologist and make a health plan and listen to your body. A lot of cancer treatments can affect your heart. So it's important to know these types of cancer risks. These chemotherapy drugs can be toxic to your heart. Radiation to the neck or chest can lead to problems that include damaging of the heart, blood, or vessels. There are specific types of cardiologists called cardio-oncologists who have the expertise in monitoring and treating potential heart effects of cancer treatment. They work closely with oncologists to help protect the heart. It's important to know this, even if you've had cancer years and years ago, you should really let your primary doctor know that you did have those treatments and that you would like to have a cardiac follow-up just to make sure that your heart looks good. Another risk factor that we can't change is autoimmune disease. And there are two types, lupus and rheumatoid arthritis. These diseases result with the immune system mistakenly attacking the body's own tissues. And it's an inflammation disease. So if you have these types of diseases, it's important that everybody on your care team know that you have an autoimmune disease because this does affect the heart. So we talked about ones that we can't change. We can't change our age, can't change our family history, can't change autoimmune, pregnancy history, chemotherapy, and we can't change those types of risk factors, but the ones that we can change, we're going to go into. Our diet. So there are so many different diets out there and they're constantly changing. And one of the main ones that the American Heart Association talks about is the Mediterranean diet, where you are eating a large majority of fruits and vegetables, grains, starches, and then lean protein with our fruits and vegetables, drinking lots of water. You want to choose healthy fats like olive oil and nuts, avoid butter, margarine, and other vegetable oils. But most importantly, you want to skip the processed foods, processed meats, sugary foods and beverages, salt, salty foods, and salt seasonings. If you look up the Mediterranean diet, they will definitely give you recipes, and it is really considered the gold standard for preventing heart disease and eating a heart healthy diet. Smoking is considered the biggest risk factor. It can lead to so many different things: early menopause, increasing your risk for heart disease even more. It can harm your heart and blood vessels, and increasing your risk for heart disease and making stroke more likely. The plaque buildup is a lot faster when you smoke. So not only can you have it in your coronary in your arteries of your heart, but you can have it in your carotid arteries, in your arteries in your legs. So it is important to know that smoking is associated with half of all coronary events. So you want to make sure that you do your best in educating yourself, and there are so many different ways and hotlines and different apps you can utilize to reduce your smoking habit. Mainline Health is proud to offer Smoke Free, which is a free behavior modification program that addresses the physical and psychological addiction to smoking. So if you call 484-227-FREE, you can sign up, and it has done really well for a lot of women in our community. So look into that. Diabetes. Diabetes is another risk factor for heart disease. It's when your body has a problem with metabolizing insulin. It causes abnormally high levels of sugar in the bloodstream. Type 2 diabetes is really the one that we're talking about. Insulin resistance, most common. Then there's type 1 diabetes, which is your body's failure to produce insulin. It's usually inherited. The gestational diabetes that we talked about with pregnancy complications, it could go away when you're after you deliver, but it does come back. So it's important to know and keep an eye on by having your blood glucose checked, and also speaking to your doctor about your pregnancy complications. How to manage diabetes? Well, Mainline Health offers a diabetes management program. If you go on to www.mainlinehealth.org and look up diabetes management program, it is a free program. I believe it's free. If not, most insurances do cover it. It's a very well established program, so I highly recommend that. High blood pressure. So I know that if you are in this series, you've heard a lot about high blood pressure contributing to heart disease and stroke. So what is blood pressure? Blood pressure is the force of the blood against the walls of the arteries. So you have two numbers. You have the top number, which is systolic, the bottom number, which is diastolic. The systolic number is the blood pressure and the force against the walls of the arteries when your heart is contracting. So you have the lumped up pause. The contraction part is the lumped up, so that's the systolic. The diastolic number is when your heart is relaxing. So it's that pause part. That's the force in the walls of the arteries when your heart is at a pause. So what are some things that you can do? Well, one of the numbers that we really want you to obtain for is less than 120/80. So what are the things that we can stay away from or help to improve our blood pressure? So obviously don't smoke, talked about that. Maintain a normal body weight, limit your alcohol to no more than 1 drink per day. Exercise at least 30 minutes on most days of the week. limit your sodium content to 2,300 milligrams per day. Eat a low-fat, low-cholesterol diet rich in fruits and vegetables. Limit caffeine in your diet, and learn stress management techniques such as meditation and breathing exercise. High blood pressure, hypertension is considered the silent killer because you really don't know that you have high blood pressure. So it's really important to manage this. This is one of the ones that you can manage. So if you have those risk factors that you can't change, such as preeclampsia or an autoimmune disease, really working on high blood pressure will help you reduce your risk for heart disease. Cholesterol. A lot of women in our community don't really know what their numbers are or what their numbers mean. So I hope that I can give you a real idea of what these numbers mean. So typically back in the day, you would go to the doctor's office, sit down with them, and they would say, okay, your cholesterol's under 200, you're fine. Well, you really need to know the breakdown of your cholesterol. So your cholesterol is made up of your LDL, HDL, and 1/5 of your triglycerides makes up your total cholesterol. Your LDLs, which you want low, they're lousy. They're the lousy ones. You want less than 100. Sometimes physicians even want you less than 70. They're the bad kids that congregate in the hallway, congregate in the walls of the arteries. So what you want to do is you want to make sure that you are eating a high fiber diet. You want to make sure that you are exercising. But sometimes with these LDLs, it's difficult, even if you do that you may need to go on a lower cholesterol drug considered what's called a statin drug. So even if you're trying to do everything and these numbers are still out of whack, you want to make sure that you are taking your statin regularly. Your HDLs, they're the high. You want them high. They're heavenly. They're the teachers that tell the kids in the walls of the hallway that tell the LDLs to get out. So your HDLs, you want them high, typically 50 or higher. A lot of times you want to exercise more to really elevate your HDLs. And your triglycerides, which are considered an independent risk factor for heart disease, they're the fatty portion of your blood. They want you less than 150. So if you look here, your LDLs, you want to limit your total fat, eat less saturated fat and cholesterol, exercise. Sometimes you will have to be on a statin. Your HDL, you don't want to smoke, you want to lose weight and exercise daily for 30 minutes or more. For your triglycerides, it's the same thing, lose weight, exercise regularly, don't smoke. But for your triglycerides, you want to restrict of alcohol use when consumed in excess. You want to avoid a high carbohydrate diet greater than 60% total calories. You want to limit sweets and refined carbohydrates such as white rice, white pasta, white bread. Go for the multigrain. HDL, you want them high. LDL, you want them low. So body weight is a big piece to this. There is a huge stigma around how women don't go to the doctor because they don't want to hear that they have to lose weight from their doctor. So it's really important to have that conversation with your physician, someone you do trust, having a conversation that does feel uncomfortable to you, but you do realize, and what are some resources out there that can help me lose weight. So when you think of body mass index, they put your height and your weight, and they put you in a category, which will be an optimal weight, overweight, or obese. You can always Google this online to see what your BMI. Waist circumference, greater than 35 inches, this puts you at greater risk for heart disease. So what are some keys to healthy weight loss? watching what you eat, but also watching your portion sizes is important. Choosing nutritious foods, like staying away from the processed foods, following an overall healthy diet pattern, and getting and staying in physical shape will help you lose weight, but most importantly, maintain that weight loss. Stress is one that we really don't talk about a lot. What is stress? It's your body's response to change. Signs of stress can be physical, emotional, or both. There are many different apps out there on how to reduce stress, but you want to learn. Here's some tips. Learn to say no. Don't promise too much. You want to slow down. Try to pace, not race. Plan ahead and allow enough time to get the most important things done. Get enough sleep. Try to get 6 hours of sleep each night. Get organized, use to-do lists, and learn breathing techniques and mindful techniques that can help you reduce your stress. Exercise is medicine. So what are some of the benefits of exercise? Everything we've been talking about over the last 5 minutes. Reduces your risk for heart disease and stroke. It reduces and manages your diabetes, high blood pressure, high cholesterol, and weight. You feel better. You become stronger, more flexible, have more energy, and reduces stress and tension. So how do you know when to start? So if you're over the age of 40, you want to make sure that you get clearance from your doctor to start an exercise program, because they're probably going to do a couple tests on you, like an EKG. And you want to make sure that they're on board and they give you, recommendations and suggestions on how to safely exercise. If you're on any medication, you want to make sure that you talk to your pharmacist. When's the best time to take this medicine, and when you should exercise? Should you take it before or after? You want to start slowly. You don't want to overdo it, because 9 times out of 10, you're not going to start back up again. And you want to choose activities you enjoy. Wear comfortable clothing and sneakers, and try the buddy system so you are accountable and have fun with someone who is exercising as well. So let's just talk real quick about some screening tools. We have that you may have heard of, a fasting lipid profile, which is a 12-hour fast where they check for your fasting glucose, your hemoglobin A1C, and your cholesterol. So the best thing for that is 12-hour fast. An EKG, so like I said, if you haven't exercised before and you're starting an exercise program, you need to talk to your doctor so they can do an EKG. There's also what's called an event and Holter monitor, and this picks up the electrical conduction of your heart. Sometimes people say that they feel skip beats, so the physician will put them on a monitor and check their electrical rhythm over 24, 48, sometimes up to a month of wearing this device to see if there's any electrical disturbances. Stress tests. Sometimes physicians will suggest having a stress test if you're having any chest pain, some of those unique signs and symptoms that we talked about earlier. An echocardiogram looks a little bit deeper. It's like an ultrasound of the heart. It looks at your chambers of your heart, your valves. And then also there's a coronary calcium score. And I just want to talk a little bit deeper about a coronary calcium score. So what this test is, it's a CT of your chest. So you wear a monitor, and then there's no dye given, and it's a 15-minute test, minimum radiation. And what it looks at is the calcium buildup in the walls of your coronary arteries. Based on this test, they can see if you have that calcium buildup, that they may want to do further testing and actually look to see if you are at risk. Based on your age, based on the amount of calcium buildup in the coronary arteries, there's an algorithm and it puts you in a range. This is the only time that you want to get a 0 on a test. So 0 is great. But if you do score high on this, Or if you do score something, then the doctor wants to take a little bit more of a workup on you. If you do have a family history of heart disease, this is a great test to have. If you currently have heart disease, then you don't need to have this test. Most insurances do cover it, so talk to your doctor about a coronary calcium score. One of the biggest things that the Women's Heart Initiative really promotes is being your own health advocate. So we talk about ways to be your own advocate, know your risks by taking the risk assessment tool online. If you score 4 or more, talk to your primary doctor about your heart health and ways to reduce your risk for heart disease. Really being well informed, and I praise you today. You coming out, looking at this video, knowing what your risks are and how to reduce them. And you can always give us a call at 484-476-3944 to discuss helping you on how to reduce your heart risk. But most importantly, you want to be your own advocate. You want to ask questions to your doctor. You want to make sure you know your family history and you're discussing that with your provider. It's okay to get a second or third opinion, and it's okay to know when to find a new doctor. If you feel that you're not being heard, it's okay for you to move on. So that is one of the biggest things that we want you to take away from this, is to be your own health advocate. A little bit more about the Lankenau Heart Institute Women's Heart Initiative. It's a dedicated program focused on educating women to be aware of heart disease and its associated risk factors. If you go on our website, www.mainlinehealth.org/WHI, you'll find more about our program. Also, you can email us at mlhwomensheart@mlhs.org. You can always call us, and we do have a Facebook page that, gives you educational programs that are coming up. Also quotes, patient stories. It's a really great group. We have close to 400 members, so feel free to join us. And this is from our Connecting the Hearts of Women event, where we honor women who've had their heart care at Mainline Health. And we're trying to build a revolution to really get out there and educate women about heart disease being the #1 killer of women. And that's what I have for you today. If you have any questions, please feel free to contact us. And I wish you all the best and heart health. And thank you for joining me.